Now, Dumi, you know we're continuing this conversation of infertility and finding out the right things that we need for our body and making sure that our feminine hygiene, and not only our feminine physical hygiene, but our mental health is also at tip-top shape. So last week, I got to sit down with Anita Prague to discuss the psychological effects of infertility. Watch this.
Salome Polycast helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.
Now we try our best to understand the hardships of infertility, but sometimes we just need that expert advice to assist us in coping with and understanding it much better. So joining us in studio today to discuss the psychological effects of infertility is clinical psychologist Anita Prague. Welcome to the show.
Thank you so much for having me.
Now, Anita, we all kind of speak about and highlight the physical effects of infertility, but please may you help us break down some of those psychological effects and what it can have on the well-being of someone who is infertile.
I mean, it's quite intense. You know, falling pregnant, conceiving is so loaded, and everybody's wanting and wishing for their baby, and then you can't fall pregnant. So you know, there's a lot of loss that needs to be handled. A lot of shame for not being able to fall pregnant, and you know, all of that pressure, and so we need a lot of assistance, and it's quite common.
Now, how common is it that women suffer from psychological effects of infertility?
You know, I don't think anyone can get away without being psychologically affected by it. I mean, I guess it's in your coping methods and the pressures that you allow and not allow to kind of get to you, I guess, and to feel supported, and so dealing with the emotional impact, I think, is quite important.
And when you do deal with such impacts, what treatment methods are there? What kind of plans can we put in place to deal and overcome the suffering that we might experience?
One would hope that the infertility clinics, or you know, the doctor that the couple is seeing, can guide them in terms of support groups. You know, if that is not available, because walking a path with somebody is super important, to be able to just, you know, vent and talk about the challenging emotions. And the hopes, you know, that get dashed, and you know, it's such a roller coaster, basically. So if, you know, failing that, they can find a therapist in their area, I guess, to also then just either go as a couple, or, you know, go individually as the lady that's not falling pregnant. It's so loaded because she's wanting to have a baby. I think her husband is also hoping and wanting, and for a woman to feel like she's not providing that, you know, it's not just affecting her in that way, it affects the husband as well, and you know, for the husband to also get support with that.
What role does the family then play in that support?
A couple should be allowed to feel their feelings. A lot of times family members, because they don't like seeing their people suffer, they want to cheerlead them out of it, and you know, quick fixes, and you know, don't stress, and so just let them ride the wave, I guess, and be with them, and not offer platitudes as such. And you know, stress plays a big part in not falling pregnant as well. So you know, the more you're not conceiving, the more stress builds, you know, the less likely it is also to happen. You know, I think we all know somebody who stopped trying and then eventually fell pregnant very naturally. So you know, that's not the case for everybody, of course, but it does happen. And you know, there are often times that there are deeper emotional factors at play. You know, for a woman, you know, there could be historical issues as to, you know, emotional blocks that stop you from falling pregnant, not just the physicality. You know, it doesn't only have to be your body that's not doing it. Sometimes your emotions get in the way. So yeah, family must just be supportive, I guess.
It seems as if one could get into a bit of a vicious cycle when it comes to the psychology of being infertile and infertility. But thank you so much, Anita, for walking us through not only our infertility in general, but the causes, the symptoms, and what to look out for, especially within a couple. We really appreciate it.
My pleasure. Thank you.
Now, thank you again, Anita, for joining us. We're absolutely blessed to have a community of women that can help us throughout our journey. With Salome, your journey matters.
Cysts in the ovaries, irregular or missing periods, and high male sex hormones are symptoms of polycystic ovary syndrome. If you experience 2 of these 3, you may have it. It's also the leading cause of infertility in women. Salome Fertility helps regulate ovarian function and helps improve fertility. Salome Polycos helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.